How substance abuse affects mental and physical health. Substance abuse has far-reaching effects on both mental and physical health. Whether it involves alcohol, drugs, or prescription medications, abusing substances can cause significant harm to the brain, body, and emotional well-being of the individual. In this article, we will explore how substance abuse impacts mental health, physical health, and overall quality of life. 1. The impact of substance abuse on physical health. Substance abuse has a direct and often devastating effect on the body. Chronic use of substances such as alcohol, cocaine, opioids, and prescription drugs can lead to a host of health complications, some of which can be life-threatening. Cardiovascular problems. Long-term substance use can cause damage to the heart, leading to conditions such as high blood pressure, heart attack, and arrhythmias. Alcohol abuse, in particular, is known to increase the risk of cardiomyopathy, heart muscle weakness, and stroke. Liver damage. Drinking alcohol excessively or using drugs such as opioids can have a devastating impact on the liver, leading to cirrhosis, liver failure, or liver cancer. The liver is responsible for metabolizing substances, and chronic substance abuse can overwhelm its capacity, resulting in long-term damage. Respiratory issues. Smoking or inhaling drugs, such as marijuana, crack cocaine, or heroin, can damage the lungs and lead to conditions like chronic obstructive pulmonary disease, COPD, lung cancer, and respiratory infections. Neurological damage. Substance abuse can cause significant changes to brain structure and function, leading to memory loss, impaired cognitive function, and brain damage. Chronic alcohol and drug use can also lead to neuroplasticity changes, making it difficult to think clearly or retain new information. 2. The impact of substance abuse on mental health. Substance abuse does not just damage the body, it can also wreak havoc on a person's mental health. The psychological effects of using drugs or alcohol can range from temporary mood swings to long-term mental health conditions such as anxiety, depression, and psychosis. Mental health disorders. Individuals who abuse substances are at an increased risk of developing mood disorders, such as depression and anxiety, or worsening pre-existing conditions. Substance abuse often exacerbates these conditions, making it harder for individuals to function normally in daily life. Cognitive impairments. Prolonged substance abuse can lead to difficulties in concentration, memory, and decision-making. The brain's ability to process and retain information can be severely impaired, leading to brain fog, poor judgment, and difficulty performing daily tasks. Psychosis and hallucinations. Certain substances, especially hallucinogens and stimulants, like methamphetamine and cocaine, can cause psychotic episodes in which individuals may experience delusions, hallucinations, or paranoia. This can lead to dangerous behavior and further mental health deterioration. 3. The cycle of substance abuse and mental health decline. Substance abuse often creates a vicious cycle where physical and mental health deteriorates, leading to increased substance use as a form of self-medication. For example, someone struggling with anxiety may begin using alcohol or drugs to cope with their feelings, which in turn worsens their anxiety, creating a cycle that is difficult to break. Self-medication. Many individuals with mental health disorders turn to substances as a form of self-medication. However, the temporary relief offered by substances often exacerbates the underlying condition and leads to addiction. Increased risk of self-harm. Substance abuse can lower inhibitions and increase the likelihood of risky behaviors, including self-harm and suicidal thoughts. People under the influence of substances may not be able to control their actions, leading to severe consequences. Key insight: substance abuse has profound and lasting impacts on both mental and physical health. Treatment that addresses both the psychological and physical aspects of addiction is essential for long-term recovery.